Hello everybody, Adopted Zebra here bringing you some breaking news in the United States regarding the Johnson & Johnson COVID-19 vaccine. Statement just released from the FDA. They are recommending a pause on the use of the Johnson & Johnson COVID-19 vaccine out of an abundance of caution while an investigation is conducted into reports of rare, potentially dangerous blood clots. There are 6 women who have developed blood clots called central venous sinus thrombosis, and it was also seen with low levels of platelets called thrombocytopenia. Now, I will explain these in just a second, bear with me. All 6 cases of these occurred in women between the ages of 18 to 48, and the symptoms occurred 6 to 13 days after vaccination. Keep in mind, 6.8 million doses of the Johnson & Johnson vaccine have already been administered in the U.S. First of all, what is happening here? Central venous sinus thrombosis is a blood clot in your brain that, when the blood is draining out of your brain, it clots off. What can happen is, once it clots off, it breaks the blood vessel and then it causes a stroke. So, what signs to look for? And I just have notes here just to help me with the urgency of the video. If you're experiencing a headache, if you have blurred vision, fainting, loss of consciousness, loss of control over movements of your body, similar symptoms to a stroke, facial paralysis, one-side paralysis, any seizures, and worst case scenario, a coma. So, if you have had the Johnson & Johnson vaccine in the past 2 weeks, please educate your family on some of these symptoms. Always have somebody with you and make sure that they're aware of what potentially could go wrong. The other thing that is occurring with the Johnson & Johnson vaccine in conjunction is a low platelet count. And why does that matter? Because platelets clot our blood. You get a cut on your finger, platelets clot it so it doesn't bleed all day, all night, forever. So platelets clot that off and create a web so that way you stop bleeding. With a low platelet count, you continue to bleed. So you have the blood vessel that's in your brain that has just burst. What's going to clot that off? Nothing. So, if you have any symptoms of easy or excessive bruising, superficial bleeding on the skin, and I'll put a picture of a petechiae rash right in here, prolonged bleeding from any cuts, if your fingers don't quit bleeding if you cut them, any bleeding from your gums or teeth that are normally healthy, if you brush your teeth, go to the dentist, take care of yourself, and all of a sudden your gums are bleeding, emergency room. Blood in your urine or your stools. If your stools become really dark black or they become bright red, emergency room. Any heavy menstrual flow for women, any extreme fatigue that is not normal for you, or if you happen to notice you have an enlarged spleen, which most of us would not notice. That would be another cause to go to the emergency room. We will know more as news comes out, but right now the FDA has recommended a pause on the Johnson & Johnson vaccine. Any questions down in the comments section? I do monitor that. Please subscribe so we can get the news out on this channel. Have a great day. Updates will come out as more news is developing.